Hey, what's up everybody? Dr. Rossi, shrinksandSneakers.com. So in this video, what I want to do is talk a little bit about a question that was posed to me the other day by a medical student. That medical student went on to say to me, how do you think psychiatry is perceived as a specialty in comparison to other specialties? How is it perceived by other doctors and other physicians in different specialties? So I think it's an interesting question. I think it's one definitely worth answering. So this is just going to kind of be a free association, off the cuff discussion about my experience with other medical specialties and how I felt as a resident working with internal medicine, neurology, emergency medicine, and various other specialists along the way. So check out the video. So in order to discuss this, I'm going to go back to my first 2 years of training, which is where I had the most experience working with internal medicine, neurology, emergency medicine, and various other specialists in the medical fields. During your residency training as a psychiatrist, you spend 6 months training outside of psychiatry during your first year. So during your intern year, you're going to do 4 months of internal medicine and 2 months of neurology. The 4 months of internal medicine will include hospital-based medicine as well as some outpatient medicine, sort of similar to a family practice clinic. The neurology rotation likewise will include similar things. You'll have inpatient rotations as well as outpatient rotations to kind of round out your education in those two areas, because as a psychiatrist, you want to know certain medical conditions. You want to be proficient in some of the basics of treating those medical conditions, as well as knowing neurological conditions, because approximately 1/3 of your ABPN board exam is neurology based. So you want to get an understanding of those things. Now, how was I perceived as a psychiatry resident versus an internal medicine or neurology resident? For the most part, I felt like pretty well. I'm going to start with discussing just my day-to-day. So I'm going to start by talking about just my day-to-day interactions. So like if I'm coming into work and I'm in the physician's lounge, I'm getting a cup of coffee, I'm in the cafeteria, how are my interactions with people from other medical specialties? Overall, I would say excellent. And specifically the ones who knew I was a psychiatry resident and had previously worked with me, say, in some capacity, either they consulted on a patient on the inpatient unit, say, or we worked together in some collaborative fashion, those people always respected what I did in the field that I was in, and they knew how important mental health was to the overall general health of their patients. So they would mostly say things to me like, it's excellent to have more psychiatrists. We really need more people doing this type of work. We hope that you're willing to stay when you graduate. So I got a lot of positive feedback and a lot of feeling that, I was really valued and that they really thought what I was doing was something important. So that's just kind of the little day-to-day interactions of just, catching people in the hallway or physician lounge, cafeteria, etc. Now, how was I perceived when I was on the actual internal medicine residency rotations? I would say equally well, and here's why. Anyone who's done an internal medicine residency or rotation, etc., as a medical student, you're going to know that there's a ton of psychiatric patients that come into the hospital all the time. They may not be there primarily because of some type of psych issue, but there certainly doesn't mean that they may not need to address something psychiatrically while they're there getting treatment for another condition or another disorder. So it's really valuable to essentially have a consult psychiatrist rotating with you on your service to offer insights and advice on medication management, provide some supportive psychotherapy, offer thoughts about whether or not a formal consult should be offered in the event, say, someone is suicidal. Do we need a consult on this person? Do we not? You can kind of use the psychiatry resident in that capacity to go and see those patients, kind of do a prelim examination, determine whether or not a consult is appropriate or inappropriate, or if this is something we can handle as an internal medicine team now that they have some expertise and input from psychiatrists. So I always felt like my opinion and my thoughts were valued by these teams, and that having me there could even help my colleagues by preventing some of these inappropriate consults and things that, really didn't need a formal consult in order to be handled. So it was a nice feeling to feel needed and wanted as part of that team and to feel valued. So I never felt at any point during my training in those 4 months like what I was doing wasn't important, or like people disrespected the field of psychiatry. I got a strong sense that they all respect. So I want to end this discussion just talking briefly about my experience in neurology, and the reality is there's a ton of overlap between neurology and psychiatry. So we are often operating in cases where, is this a neurological disorder, is this a psychiatric disorder, and sometimes that's hard to differentiate. So what's nice is you almost have like a dream team of a neurologist psychiatrist team or duo coming into these patient cases and coming at each individual case from the perspective of both a neurologist and a psychiatrist. So it's really nice to have that opportunity to view each case from the neurological standpoint, but also from the psychiatric standpoint, and to kind of make those collaborative decisions. Now, when working with neurology attendings, at no point did I ever feel undervalued at all. I think if any specialty understands psychiatry the most, it would be neurology. And a lot of us, myself included, considered neurology or psychiatry, vice versa, as potential career paths. And the last part I want to discuss is just a little bit about there still being some stigma associated with being a psychiatrist, and there are still some people out there who are going to undervalue the services that you provide as a psychiatrist. However, I think a lot of that is a little bit of jealousy and envy that, the lifestyle of the psychiatrist, the work of the psychiatrist is a lot different than other medical specialties, and, they're a little bit envious of the benefits that we have as psychiatrists. So there's some of that, but there's also some archaic people who still are out there thinking, hey, this is, this is an easy field to get into. It's not very competitive. It's what you do if you can't do anything else, right? It's the specialty you end up in by default if you're simply not good enough to be an internal medicine doctor or something like that. So yes, there is a little bit of that. You may encounter that occasionally, but I would say the vast majority of physicians, including people in specialties like orthopedics and surgery and some of these more maybe type A personalities that you might encounter, they also are very receptive to mental health. And these are, like I always say, often things that these people and these other specialists do not want to deal with. They don't want to deal with, the suicidal patient, the difficult bipolar patient, the depressed patient. Those are not things that they're interested in. They're interested in, solving problems surgically. But overall, even in those specialties, and for the most part, I have not encountered a whole lot of situations where I felt uncomfortable or I felt like I was being undervalued as a member of the team. So if you guys like these videos, if any of this information is helpful or the discussion is interesting, always, like and comment. We are interested in hearing from you.